This 57-year-old patient was referred to me for endodontic treatment of tooth number 7. According to the patient, because his bite is off, that's what he said, his bite is off, his bottom teeth over the years been traumatizing this tooth. And recently he noticed the tooth was hurting even more. There was, he said tooth felt loose. He went and saw his dentist, and the dentist told him that his tooth was abscessed. As you can see, you see that large periapical lucency there. Anyway, so he's under the care of the dentist, but his dentist referred him to us, so we can proceed with endo on this case, on this tooth. Tooth was tender to percussion and palpation when I saw him. Probings were 2 to 3 millimeters. There was Miller class almost 2 mobility associated with the tooth. I cold tested number 6 and number 8, and they both responded within normal limits to cold. Of course, number 7 did not respond to cold. We discussed options with the patient, and patient wanted to try to save the tooth. So that's what we did. But as you can see, I knew ahead of time that I would be needing to place an MTA plug. So my assistants were ready for the placement of an MTA plug. So this video is going to be a short video because I'm going to show you how, again, I've made, I don't know, I think 10 videos on how I place my MTA plugs, but this is another opportunity to show you guys how I do it again. Anyways, let's go and look at the clinical case point of view video of endodontic treatment of this tooth number 7 from start to finish, and let's go ahead and place an MTA plug all in one appointment. All right, followed by gutter perchance sealer. I use the Zoomax microscope, as you guys have noticed for the past month or so. This Zoomax microscope has an integrated 4K camera, so makes documentation very easy, very easy. So let's go ahead and look at the clinical point of view video. So this is the microscope that I have. As you can see, integrated 4K. And continue zoom. It's a great microscope. And here's the microscope again. It comes with a stand, or you can have it mounted to the wall. But this is a demos for us, so it came with a stand. There is a, as you can see, monitor attached to the pole of the stand. So whatever I see here on the microscope, my assistants can see, and then of course the integrated 4K camera. So this is a microscope. It's a great microscope. So if you're in the market for a microscope, this would be definitely a microscope to consider. Very good. So topical is administered by one of my assistants. So I'm telling the patient exactly what I'll be doing, and local anesthetic is given, buccal infiltration. I'm using lidocaine here. Always give a palatal infiltration as well, because the rubber dam clamp could be a, could pinch. Actually, it does pinch the palatal gingiva, and it could be painful. So I just want to make sure my patient is comfortable. All right, so rubber dam goes on. I'm putting the rubber dam on tooth number 5, and then I'll do sectional. So I'll just pull the rubber dam forward and floss it in between. See, I'm putting the clamp on tooth number 5, making sure the tooth is stable. Rubber dam goes on. And then just pull the rubber dam forward. And that's it. In this case, we didn't even need to floss. All right. Took 20 seconds to put the rubber dam on. Very good. You saw my gloves touching stuff, patient's mouth and everything. My gloves get sprayed. Okay? But my gloves either get sprayed with the PD Care or with Caviside. My assistant just sprays my gloves with them, and then I just rub my gloves against each other and basically decontaminate my gloves. So that way, if I'm touching a file, if I'm touching my instruments, as my assistants hand them to me, I'm not cross-contaminating everything. Right then, my assistant wipes the tooth, the rubber dam clamp, the adjacent teeth, all. She wipes everything down with isopropyl alcohol. Very good. Let's go ahead and make our endo access. Again, I'm using the Zumax surgical operating microscope. My assistant to the right is blowing air on my mirror. I'm using a very thin end cutting diamond. Straight line access. Using my Endo Explorer. All right, we got it. Going in with 6% hypo straight away. Irrigating with 6% hypo straight away. Number 20 flare file, reciprocating handpiece that I'm running at 1000 RPM with torque off, up and down, brushing motion. I don't want to push it too far right now. Remember, there's still necrotic tissue in the canal. So I don't want to push all of that out of the canal and cause a post-treatment flare-up. But I'm opening it enough so I can introduce 6% hypo deeper into the canal. But this, as you can see, the canal is wide open, so now my flare file wants to go all the way to working length. All right, let's go ahead and irrigate it again with 6% hypo. Irrigate the canal with 6% hypo. Pay attention to how I'm using the needle, irrigation needle and syringe. Up and down, up and down. Very minimal pressure on the plunger with my thumb. I don't allow the irrigation needle to bind to canal walls. Those are all important. In 24 years of experience, I have never experienced a hypo accident. 24 years of practice, never experienced a hypo accident. Learn how to use the tools of your trade properly. I'm using the Fine Pex apex locator by 8 Teeth. It's a great little apex locator. This canal is long, as you can see. All right, so I'm giving it to my assistant to read the measurement. All right, now that we've gotten our measurement using our apex locator, I'm going in with 6% hypo again. All right. All right, number 15. 2 working length. This is a number 15 C file. See how I'm using it? Up and down, brushing motion. When you use this reciprocating handpiece at 1000 RPM, you're not only instrumenting and shaping the canals with it, you're also sonically activating the hypo. 6% hypo again. Very good. All right. S2 of the eFlex S series of NiTi files manufactured by 8 Teeth. I don't like the S1, as you guys know. The S1, the apical field millimeters, is very thin, very susceptible to fracturing. So I skipped to S2, and as you can see, I'm using it in an up and down and brushing motion, and you saw how much dentin it cut. All right, went to working length. Again, 6% hypo. The files. So the S2 has a 0.4 variable taper. S1 has a 0.2 variable taper. And then F1 has a 0.7 variable taper, 0.8 variable taper, and then 0.9 variable taper F3. These are great files for the money. So they come in packs of 1, 2, 3, 4, 5, 6. This is the orifice opener, the SX. They're kind of equivalent to the Pro Taper files. F1. Went in. Just went too fast. All right, let's try again. Okay, F1 to working length. All right, didn't cut much. And as you can see, I'm using the 25 millimeter file, so the working length is 25 millimeters. So the F1 didn't really cut much. And I'm starting to get some purulent discharge. All right, let's go to the next one. Next file. A little bit of resistance to working length. Yeah, again, it really didn't cut much. You didn't see any dentinal shavings in the flutes of the file. So that means it just glided up the canal. Didn't really do much cutting. Again, copious irrigation with 6% hypo. All right, next file, the blue file. Let's see if this one cuts. Yeah, it cut. You saw the dentinal shavings in the apical few millimeters of the file? Yeah, it did cut. That's great. All right, so again, 6% hypo. And look, my working length is 25 millimeters, right? When you take this irrigation needle to the hub, that's 23 millimeters. So I'm taking it 2 millimeters away from the working length. All right, next file, large file. Yeah, didn't really cut much, just maybe a little tiny bit in the apical area. 6% hypo. So you can see my apical diameter is very large, but I'm not afraid to use 6% hypo. And I'm using 6% hypo very comfortably without causing an hypo accident, even though I know my apical diameter is pretty wide. And I'm taking the irrigation needle to about 2 millimeters away from the working length. All right. I'm trying to get now, I'm using a stainless steel K file, number 50 here. I'm trying to gauge the apical diameter of the canal. If it binds to working length, then that's my apical diameter. All right, this is a number 50 stainless steel K file. Six percent hypo again. You see, there's a flow to all of this. There's a pattern, there's a flow. After each file introduced into the canal, it's followed by copious irrigation with 6% hypo. Wide open apical diameter, but I'm not afraid to use 6% hypo. You can see I'm taking the irrigation needle to the hub, which is 23 millimeters. My working length is 25. No hypo accident. All right, let's use our microsuction and see if we can get any discharge. And look, lo and behold, lots of discharge. Remember that large periapical relucency? Yeah. Filled with purulent discharge. So my apical diameter was 50. And I'm done instrumenting. All right, so now I'm just decompressing. trying to decompress. The purulent buildup in the periapical area of the tooth. Periapical area of the tooth. All right, so microsuction. It's a great tool to have, and you can make your own microsuction. I believe this is a calcium hydroxide tip. You can buy them on eBay, or your dental supplier. Just tell your dental supplier what you're looking for. All right, so let's see. I'm taking a sterile paper point to working length, 25 millimeters, and I want to see if I'm getting any discharge, if it comes out wet. And it didn't. It did not come out wet. So here we go. White MTA, WMTA goes in. This is the MTA carrier that I use. White MTA goes in. I'm using the number 2 Buchanan plugger to push the MTA further in to the canal. And then I'm going to use that, remember that 50 file? Stainless steel K file? Yeah, I'm going to use that because that represents the apical diameter of the canal. And I'm going to introduce that into the canal, and I'm going to push it to working length. And I'm going to, with that, I'm pushing the MTA to working length. This is how I do it, okay? There are other methods, other ways that people do it, but this is how I do it, okay? Again, white MTA goes in, MTA carrier. I'm putting 2 loads in, so we have many of these MTA carriers, and my assistant has them filled up, so she just hands them to me quickly. All right, I'm using the number 2 Buchanan plugger to push the MTA in. So I can use the number 50 stainless steel K file and kind of condense the MTA, push it to working length and condense it. What do you see here? See, real world endo. Discharge from the periapical area, pushed all the MTA out. So I need to start over again. 6% hypo irrigation. As you can see, I'm taking it to the hub, which is 23 millimeters, only 2 millimeters away from working length. All right, so microsuction again. Remember, MTA has a very high pH, just like calcium hydroxide. See, I'm getting more discharge. All right, let's go ahead and put more MTA in and see if we can plug that. All I need to do is just put an MTA plug there. And again, as I said, remember, MTA has a very high pH. That's how it kills bacteria and neutralizes the bacterial toxins, just like calcium hydroxide does. All right, so more MTA. Number 2, Buchanan plugger. And then number 50, stainless steel K-file. I'm feeling a little resistance, which is great. So more MTA. Number 2, Buchanan plugger. Number 50, K-file. And as you can see, my working length is 25, and now number 50 doesn't want to go to working length, which means that I've created a plug, apical plug already. See that? More MTA. Number 2, Buchanan plugger again. And number 50, stainless steel K-file. Again, you can see that I've created an MTA plug now. Number 50 doesn't want to go to working length. It's short by a few millimeters. That means that I've created an MTA plug. So the good thing with MTA right now is that because the apical diameter is large, of course, if it's 50 or larger, I recommend, if it's possible, to place an MTA plug instead of gutta percha and sealer. Now, if later on I need to do an apical on this tooth, let's say patient comes back in 6 months and we see that the periapical radiolucency hasn't healed, and I want to do an apical, I already have MTA there. My apical's gotten so much easier now. I don't have to retro prep and retrofill because I got the MTA there. All I need to do is incision, cut the apical few millimeters of the root, And that's it. I'm done. There's already an MTA plug there. See that? See what I mean? So we're looking out for our future and this patient's future, and how much an MTA plug can make things easier for us if later on we need to do an apical. All right. So more MTA and stainless steel K file. As you can see, I've created about right now about maybe 6 or 7 millimeters of an MTA plug. See? Solid. You see that? It's solid. It just, I'm hitting the concrete wall, and that's what I'm looking for an MTA plug. A solid block of concrete. All right. Very good. It looks like maybe 6 or 7 millimeters. All right. Let's use a large sterile paper point and make sure that our canal walls are dry, and they were. All right. Now, next thing is, I'm just trying to measure how much MTA I got in there. I don't want any gaps between the different layers that of MTA that I put in. I don't need any gaps, so that's why I was checking to make sure. All right, a little bit of air. Look how beautiful it looks, nice and clean and dry. All right. Again, I want to make sure that my working length and everything is okay. There's no there's no moisture in the canal. I use the sterile paper point, and now I'm using a sterile paper point and putting AH plus sealer, coating the canal, remainder of the canal walls with AH plus sealer. Just coating the canal walls with AH plus sealer. And then I'm using my obtura gun, and I'm going to backfill the remainder of the canal with gutta percha. And that's it. I'm going to use my Buchanan pluggers 2 and 3 to condense the gutta percha, then clean the tooth with 70% isopropyl alcohol, sterile sponge, cavit, and refer the patient back to his dentist for the permanent restoration. Ask the patient to come back to see me in 6 months, so hopefully the patient will show up. and I'll post that video as well. All right, let's fast forward this. I'm adding gutta percha accordingly with my obtura gun. Buchanan plugger. Just fast forwarding. All right. 70% isopropyl alcohol to clean the tooth and the walls. And then I use air to dry it. There you go. Sterile sponge goes in. As you can see, that's a blue piece of sterile sponge. And then cavet goes in, and that's it. We are done. All right, very good. Rubber dam comes out, and that's it. We're done. So now you know, again, how to place an MTA plug when we finish everything in one appointment, despite the fact that there was purulent discharge. The apex locator that I used by 8 Teeth, as you can see, is called Fine Pex. It's rechargeable. So you don't need to put batteries in it. You can basically charge it like your phone. This is the obtura gun that I use. It's called Obtura 3 Max. So there are gutta percha pellets that we purchase, and we put those pellets in here, press the plunger in, and basically melts the gutta percha. And then as you press this, gutta percha comes out from the tip. It's like a glue gun. Obtura 3 Max. Okay? I'm not affiliated with any of these companies, by the way. AH Plus sealer. My endomotor. I love these. I have many of them. That's one. Dent Supply. Tulsa Dental DTC motor. They're great endomotors. My X-ray sensor, Chic 33 by Sorona. Portable X-ray units, Cavo, Nomad, Pro 2. Manufactured by Cavo. System B. Also have the 8 Teeths Hyperlight X-ray gun. Great unit. Ultrasonic. My ultrasonic unit is Ultraman Pro by 8 Teeth. Great unit. I put 2% hypo in here and do ultrasonic irrigation and activation with it, and plus I can do all kinds of other stuff. Looking for middle mesial canal, MB2. It's got all kinds of settings for restorative, perio, and endo. It's a great unit. This is my M4 safety handpiece, manufactured by Kerr. It's a reciprocating handpiece, so you can put stainless steel K-files in here, and it reciprocates. I like to put it at 1,000 RPM, torque off, and you've seen how I use it. It's a great device. I use it to create glide paths for my NiTi files if I ever need to use NiTi files. So here's our post-op. So take a look. This is our MTA plug here, white MTA plug right here. All right, followed by gutter perchance sealer. So let's say in 6 months, patient comes back. I hope he comes back, and we'll see that this periapical relucency hasn't healed. I mean, I don't expect it to heal 100%, but I definitely need to see some reduction in the size of this periapical relucency in 6 months. If I don't see it, then of course we would recommend an apical. And now if I need to do an apical, now look what happens if I need to do an apical. My apical will be so quick because I don't need to retro prep and retro fill again. I'm just gonna go ahead, make my incision into the gingiva, lay my flap, and get in here, cut the apical few millimeters of the canal, of the root, right there. And look, I have plenty of MTA left in the apical area. Once let's say I cut to here. Look how much MTA I have. I have probably 4 millimeters of MTA remaining as my plug, apical plug. And then I'll just clean all of this during the apicectomy surgery. But as you can see, everything went beautifully. Again, I'm hoping that this patient will come back in 6 months for a post-op check, and I will post that video. But as I said, if I need to do an apical, my apical is so much easier now, so much faster, quicker, easier now, because I already have an MTA plug there. All right, so this is how I place my MTA plugs. You can modify, you can watch my video and then come up with your own, modify my technique. You don't have to do everything exactly the way I do it. You can watch my video, get the idea, and then modify it to your liking and the way that works for you. If you like these videos, these clinical videos, please make sure that you have already subscribed to my channel. You can also follow me on Instagram and TikTok. But anyways, I only post these clinical videos on YouTube though. So if you like my videos, please make sure you press that like button, make a comment, give me some positive feedback, positive energy so I can continue. Tell your friends about this channel. You know, I'm doing it for free. I'm not making a dime from these videos. You know, people who put videos on YouTube and they make thousands of dollars a month. They have 4, 5, 6 million followers. I don't make a dime on these videos, so I'm just doing it for free. So make sure you tell your friends about my channel too, so that way they can come and they can learn as well, because as I said, I'm doing it for free. So let's spread the knowledge. All right, so don't be so stingy, and have a great day, and see you in the next video.